Hello, welcome to Fourth Trimester Voices. My name is Dr. Chowa and I'm your postpartum care advocate. Today we are on a podcast and we are joined with the wonderful Sharnece Thomas, the founder and lead therapist of Serene Solutions Counseling and Consulting Services, serving women through their transformative seasons of pregnancy, postpartum, trauma, and life transitions. In addition to her clinical work, she offers therapy intensives which include Empowered Motherhood Intensive, perinatal psychological education, corporate counseling for organizations supporting women in transition, plus resources such as Growing in Grace Pregnancy Journal and Worry Less, Find Peace Guide Anxiety Journals for Mom. So, today we're going to dive deep into maternal mental health, birth trauma, identity shifts in motherhood, especially in the fourth trimester, and how women can move from surviving to thriving. Shanice's insight is exactly the kind of grounded, empowered conversation I knew my audience of moms needed. Welcome to Fourth Trimester Voices, the podcast where we delve deep into the fourth trimester. I'm your host, Dr. Chowa. Welcome to the show, Sharnece.
Thank you for having me.
Yes. So tell us a little bit about your journey. How did you land in this maternal mental health space? What was the aha moment that said, this is what I want to do?
The aha moment for me actually came back when I was working with children, probably up until about, I don't even know what year this is, 2020, probably around 2017. Because as much as I was working with kids and loving it, more often than not, I found myself supporting mom
Mm,
in terms of different roles and parenting their children and what those transitions look like, or even kids who were adjusting to a new sibling and just
mm,
having moms coming in struggling with, I have this older kid who needs support. I have this newborn who's pulling on me. I have household responsibilities, still working. A lot of those things were coming to me, and I was just really enjoying the individual work with moms. And that's when I decided like I wanted to make that transition to that population only.
that makes perfect sense. And how long have you been working in the maternal health space?
So it's probably been solely maternal health space, probably about the last 8 years.
Now, you're also a mom, and maybe you could tell us a little bit about your birth journey and if it inspires you to also do this work that you do.
So I am a mom of a almost 14-year-old and then a 2-year-old, and two
You had
different
postpartum
women.
all over again.
For me, like with my oldest, I did experience postpartum depression.
Mm,
But as a therapist, I did not want to call it what it was. It
wow.
wasn't until he was probably about a year and a half, 2 years old, when the doctor said something about some health concern he had, and I just broke down in tears. We had a traumatic experience after he was born where breastfeeding was not going well. And I was 26 years old. I didn't know what I was doing. I was in Florida, family nowhere near. It was just me and the dad and the kid. And he wasn't latching properly, so he wasn't getting enough milk. And he ended up with birth weight dropping really low to the point where he ended up hypothermia. And so we go to the first appointment. I had him on a Thursday, and we went to the first appointment on the Monday, and they looked me dead in my face and said, "You have to take your baby to the hospital." No
Mm.
mom, no dad, like just me and him. He went to work and I took the baby to the hospital. And I cried for the whole week he was there. Felt like a failure, felt like I had like really just let everybody down. Ended up gaining his weight. They had a lactation consultant who worked with me, but I could not shake those feelings. It took probably about 2 years for me to start feeling like myself again after he was born.
Wow. And what helped you get through that time?
So I really relied on friends. I went to my own therapy because as much as I was helping other people, I would hear like similar stories because then I was working with adults as well as children then. And I would hear people going through something similar. And I'm like, I can't sit here and help people. And I'm not doing what I know I have needed to do and I've put off because I didn't want to say the words. I was determined not to have to say this is something I had. And when my therapist and the doctor, first the pediatrician, then my therapist said, Sharnece, it's okay. And
Mm,
really normalize that for me. It like lifted the cloud. But it made me determine when I had friends or family, anyone who had babies after me, I was right there. How are you doing? And checking in because I knew what that felt like.
What do you think are some of the reasons that moms really have a difficult time naming it? Because I struggled with the same thing. I probably didn't call it postpartum depression until I was at the last straw, and I was like, okay, I really think this is, and really it also took my neighbor coming in and being like, girl, you okay? It really
Mhm.
took me a while to understand or accept what was going through my body, my mind. And so, how do you get moms to that point?
One, I like to remove the shame. Oftentimes, moms will say to me to admit that was a thing, there's a feeling of being a failure, or a feeling as they did something wrong, or even just the stigma behind mental health in general. And so for me, I like to remove the stigma. I like to talk to them about how hormonally this
Mm,
could be triggering some of that. There's a lot of reasons for it, but I emphasize we can get to the other side.
yeah.
If you trust me, if you trust the process, we can get you through this. And I'm going to blank on the quote now, but there is a quote from Mr. Rogers about anything that is mentionable is manageable. And so I will often throw that out to them in terms of the fact that if we just say the thing, label it, identify, we can work through it. We can
Mm,
find your village. We can get whatever resources and things in place. But sometimes it's just having someone say back to them, this
mm,
is what this is, starts to lighten the load and get them to a space of being open to, now I can say the scary thoughts about what if I hurt my baby, because
mm.
they know they're in a safe space and they're feeling supported.
No, that makes sense. Now, you talked a little bit about your journey with breastfeeding
Mm.
and also how it took you about 2 years to get through just trauma that you experienced during your postpartum journey. I really truly feel that birth trauma often goes unrecognized, recognized, and it looks differently in different births. How do you define what is birth trauma and really what is PTSD? What are the signs that moms or birth workers should be paying attention to when it comes to a new mother? Because now you hear the term birth trauma, but
Mm.
what are the actual definitions of that and how do we get women through that point?
So when I think about birth trauma, I think about any sort of distress that came as a part of dealing with pregnancy, childbirth, and even rearing child in those first couple of weeks. Because a lot of times I'll hear people talk about birth trauma from what happened in the hospital in terms of not feeling
Mhm.
heard, or decisions were made because I was out of it. We had a client the other day labored for 40 something hours and then it was decided to do a C-section, and just like the trauma in hearing you had this birth plan.
Mm,
Now we have to go do this other thing. And so I think of anything that causes anxiety, women
okay.
who are having flashbacks, even avoiding thoughts or reminders or memories related to what
Mhm.
happened. I've even seen for some people where it comes up once they're pregnant again,
Yes.
which I experienced that myself in terms of not wanting postpartum depression again when it came to my 2 year old. And so the amount of anxiety and fear that comes up, and I've even seen for some women where there's like a decision paralysis
Mhm.
of, I had this whole thing the first time, and what if it all just falls apart? What if it all just means nothing and the same thing happens again? And it's just like replaying it over and over.
No, it makes sense. In your practice, you talk about, at least when I was reading, you have a lot of different combinations of types of therapy. We talk about trauma informed, CBT, DBT, CPT. There's a lot of abbreviations. How does a mom go about determining what kind of therapist that she needs or where to exactly look? How does a mom find a therapist when they're going through something?
So there are tons of directories. You can go through your insurance company directory to figure out what providers are out there. The one thing, if someone calls me for a consult, I always empower them to research, what the different letters mean. Because in our field, we have a lot of letters.
TRBT, girl.
Right. I have people who will call me doctor. I'm like, I am not a doctor, but they don't know what any of these things mean. You want to look for individuals who have experience with the population, but who also have training.
Got it.
It's one thing to, I've always worked with moms, but I was able to go through a training through Postpartum Support International that focused on a specific credential in perinatal mental health. Still need
Mm,
to test. I'm going to do that by the end of the year.
Okay.
You're looking for that. For me, there's also request the consultation. If you don't know if this provider is for you, or the website looks great, they say a lot of different things, but now we have ChatGPT and all these other things out there, right? So we can say a lot of things, but talk to the therapist and see what kind of feel you get. I think there is something to be said for that gut feeling, especially for moms. We have an instinct, it's a superpower. And so being able to talk to the therapist, and also if I'm doing a consult with someone, I empower them to say, this does not work for me.
Mm.
People who've come to me after having other experiences with other providers, and they stuck it out or they stayed there just because they didn't feel comfortable saying, hey, this is not working. And I give all of my clients permission in therapy, if ever we are talking about something or doing something and it's not working, or you're not feeling it, or you have concerns, stop me right away and tell me this is not working.
Okay, no, that makes perfect sense. From your vantage point, how does the lack of maternal mental health affect our communities at large and families, workplaces? How is this gap in care? Because there's a lot of women who are not getting the treatment that they need. How is it affecting our society at large?
I think it's affecting our society at large because we have a lot of women who are walking around feeling like they're on an island.
Mm,
We have a lot, I think, because of we see these videos or we have these messages, or we'll even see previous generations where they just did the thing, right? They did the thing. There was no room to complain or say, I don't feel right. And so we get this idea of, I just got to push through. I have to keep going.
mm,
And it's unfortunate because I've even seen within friend groups where they're both struggling and have not said a word to each
wow.
other, even though they're both dealing with this new mom thing. And so I think the issue that we're up against is either people aren't comfortable talking about it, or even in the workplace, like managers can be well meaning, right? Or they could want to say, hey, how are you doing? But there is this fear that they're going to offend.
Mm,
And so I think there has to be an openness to check in on the individual.
right.
Um, and also recognizing that mental health is not bad. I tell all my clients, everybody has anxiety. It's our protective factor. It's just when it impacts sleep, it impacts being able to eat, it impacts being able to function or leave the home or let anyone else hold your baby. That is when we know, okay, something is going on here, but they're not the only person dealing with that anxiety. Everybody has anxiety.
Yeah. How do we as a community, and I say as a community for Black women in particular, how do we move towards a society that embraces therapy? I get to the privilege of talking to a lot of different women, and one of the things that women are really scared of is how reporting their mental health concerns will affect their job, will affect their parenting. Are they going to take my child away if I say I have postpartum depression? I think I even had a doctor one time tell me I try not to get my patients to report postpartum depression because it will affect their disabilities or their life insurances. I feel like these are a lot of myths and misconceptions that keep our community away from mental health. And I
Mhm.
don't know how to move past that barrier of being like, hey, we need these services and we just need to find the trusted people who we can talk to, but not just say, hey, blanket statement, we're not gonna do this.
I think you hit the main point, it's education. I am regularly having to tell people, just because you're depressed, that is not grounds to take your child away.
Right.
Because baby is coming here dressed to the nines, and you're the one that's not dressed to the nines. There is no one to think that something is going on with this baby and they're not safe. I think because that is the big one. Like, I don't want to lose my children, or like here in the DC area, like I have a clearance and I don't want this information being put out there. But these things don't automatically eliminate any of those things. It
Mm,
is really about, even in the life insurance process, I have seen where it is more about what is the severity. If do they think you're a risk to harm yourself? And that is what happens. And as a provider in this area with a lot of people with clearances and things like that, our documentation can safeguard that. Everything doesn't go in a note. And so I have to also let people, I show them examples. This is what my note looks like. There is nothing in here that someone would pull and be able to use against you. It literally is laying out what we focused on. But they don't know that. And
Yeah.
so part of it is one, educating our community in terms of you need the help regardless,
Yeah.
and anything that comes up can be addressed. And someone's always going to have that one story about this bad thing that happened to that one person. And so that is what they use to justify. And I always remind them there are definitely dynamics. There are probably things you don't know about in that situation. And usually I can say, with the situation that I know of you here in front of me, I don't see grounds. And I'll be honest, if I do have someone who might be severe postpartum depression where I feel like, hey, maybe we need to consider hospitalization. We figure out who's going to take care of baby while you're in the hospital that you'll be comfortable with in the meantime. And I have seen people who've had to go inpatient and come out and bond with their baby and everything works out.
Education is really
Mhm.
key. And we do that with the community. So sharing that. I do think we need to go through a couple definitions that we didn't talk about just to educate our moms who may not really understand some of these mental health conditions. What are the top three mental health conditions that you see in the perinatal period, particularly postpartum?
Okay. So definitely postpartum depression, postpartum anxiety, and then I tend to see a lot of postpartum OCD. And
Interesting.
the follow-up, I would say, would be rage.
Be rage.
Mhm.
That rage. Yes, I got some of that.
Mhm.
Go ahead and talk about postpartum depression. What are their symptoms of postpartum depression? How do you know that, okay, this is not just baby blues anymore?
So once they pass the 2 week mark, so
Okay.
baby blues is typically the depressed mood, no motivation, maybe some sleep difficulty, a lot of crying. Those can all fall under baby blues. Once they've passed the 2 week mark, we're looking more at, okay, maybe this is the postpartum depression. And it's similar symptoms in terms of the depressed mood, crying episodes, any sort of insomnia or hypersomnia, any issues with difficulty remembering things, maybe even being disengaged, maybe feeling I can't take care of this baby, I don't want to take care of this baby, I don't want anyone touching me. Those could be some of the things that would let us know, okay, this is some postpartum depression that's lingering.
Got it. Got it. Now, postpartum anxiety, I feel like that one is very underdiagnosed as well. You're a mom, you get anxious. Like I slept next to my daughter and looked at her breathe because I didn't want her to die. Like, I think about that. I'm like, at that time, I didn't think there was anything wrong with it. I just thought it was like my mom protective brain. But in retrospect, I'm like, girl, you did not leave the house ever, right? You stared at your child. You couldn't, I remember opening the bathroom, using the bathroom, staring at my kid. I couldn't even use the bathroom in peace because I'm thinking something's going to happen. But nobody really, I feel we have tools to screen for postpartum depression. I can't say really good because even with those tools, clinicians, we don't recognize or act on that. But postpartum anxiety, I do find from a clinic standpoint that this is something that's really hard to pick up unless family members maybe mention something to mom. But I actually don't believe that we are great at tools to identify this when we're screening moms.
And I can't even recall offhand a tool
There
for
isn't.
that. I usually will use to assess, like I'll use I have a scale that I use in terms of functioning on their different areas, whether it's social or those sorts of things. And then I usually will use like a GAD-7 but those are really assessing for the presence of anxiety and the
Right.
severity, but not necessarily distinguishing it. And then when I have encountered postpartum anxiety, I usually find I will use it as a diagnosis in situations where someone wasn't experiencing it before. So even myself, from the diagnostic standpoint, I usually will revert to generalized anxiety just for paperwork for insurance purposes because that was already the diagnosis presence. And usually, if I have someone who was experiencing that beforehand and then they're coming after baby,
Right.
we're already approaching it from your anxiety is probably going to be heightened. Like I'm always doing preparation and trying to connect them with other groups of women who have children. Stand some of the things you said, like I'll have moms like I'm regularly checking if they're breathing, but some of that's normal. I
Okay.
think if you're like, I don't sleep at all because I have to watch if baby is breathing, or
Yeah.
even I won't let anyone hold the baby because I don't know what something could happen. I've had folks who are like, I can't even leave the baby, but we're talking months later, or just the intrusive thoughts, whatever the content of those are as well. I'll say, okay, well, look, postpartum anxiety right now. And then if it continues on beyond the year mark, then we usually shift to.
Generalized. Makes sense. Who is at risk for mental health issues postpartum, and how do women seek out that help beforehand? I find that getting people to therapy is really a stretch. And so when I'm talking to pregnant women, if I there's certain things in my brain that I'm like, oh, we got to set you up for therapy, and they may not necessarily, well, never had any issues, but I'm thinking, oh, whatever happened then, that could come up. How do you counsel women and encourage them to seek out that care postpartum? Or if you were talking to women here on this show today and you had the opportunity to get people to therapy, who would you say like you need to get somebody before the postpartum period?
Anyone who was dealing with any sort of anxiety,
Mhm.
anyone who experienced any sort of stress or depression during pregnancy or before. So if they had mental health concerns before, we want to be in front of somebody right away. I really encourage, and I encourage just all of my clients who are pregnant, we schedule an appointment at the 2 week mark if it's feasible after
Mm,
they've had baby, because I want to say, are we dealing with the blues or has something else manifested? And I also want them to know right away support is there. I had
absolutely.
11 therapy babies this summer. That's what
Wow.
I call when my clients have babies. And I love when the pictures started flying in, but that was also my trigger of, okay, starts our countdown. If I don't hear from them about an appointment, I'm reaching out. But I
Got it.
think for individuals, I say just maintenance.
Mm,
You don't even have to have had something that happened before, because as we know, there can be a hormonal component or a genetic component. It should be rule of thumb, whether they're embedded in an OB's office or you seek them out before. Like, I try to network with as many OBs as possible to say, hey, tell them to just do a check-in session. Let's just do a consult.
it's the
If you
car.
don't have insurance, we'll figure it out. But just get in front of someone, be able to say all of those things, whether if you're feeling great, just tell someone, I feel great. Motherhood is amazing. I'm right in there. I'm feeling confident. You just never know what could be the trigger. Like I said, the factors, especially if you've dealt with it with a previous pregnancy.
Absolutely. Tell us a little bit about your practice and some of your initiatives that you have. I know you have two resources that you give moms. What does it look like working with you?
So, working with me, I would say you're definitely going to get a space where you can be as honest as you need to be. I always laugh when clients will apologize about cussing. I'm like, "Girl, I'm not offended. Say what you got to say, use the words you have. They're all words in the dictionary. Now I think about that, but that is usually what I say. It's in a dictionary or it's somewhere. I want it to be as laid back as possible so that people feel comfortable. For me, it's also very important that they understand that they are in a space with someone who gets it.
Absolutely.
I had the experience of going into my second pregnancy, freaked out the whole time about ending up with postpartum, which is
Mhm.
actually where the pregnancy journal came from. Because after I came through the woods, after my second child, I went back because I was intent that I was going to journal and being aware of how I was feeling physically, mentally, and emotionally through the entire pregnancy, just in case something was coming up. And then I used that journal to actually come up with the prompts for the pregnancy journal I put out after. And fortunately, I did not experience postpartum depression with her.
Yay.
Um, and I also recognize my circumstances were so different.
Yeah.
And my age was very different too.
Right.
So life like looked very different. And so I recognize there were other factors as well. But I do feel like being on top of my mental health, seeing my therapist, all the above were really crucial to that transition to baby number two
Number two.
and still being away from family with baby number two. Because I left family to move away again.
Oh,
Um, I'm big on resources, but more importantly, I'm just big on coming as you are. I am not, there are therapists who will give homework, and I think there are certain modalities where that is appropriate and where that fits. I will assess where everyone is in terms of if they have the bandwidth. And so I
yeah.
have some clients who are like, no, give me the prompts, give me the work, and I have it for you. And for some clients who are like, this is my space where I can breathe and reset, we reset. I incorporate some mindfulness. Now, they all know I am not the type to sit there and read a script and you meditate in my office. I feel awkward. I don't know that I even think my voice is soothing, right? But I will turn on one of those recordings I have so that you can meditate in the moment if you need to. I'm always emphasizing and promoting for groups. I'm hoping to do a group intensive soon, probably New Year, because this year is moving very quickly. But it's important to me that they are connected with other women, whatever that looks like. If we have to make connections, or like here in this area, we're fortunate where there are a lot of groups for moms. And then I'm really, for anyone I always recommend, or do you have a lactation consultant? Thought about a chiropractor? Have you thought about, I have some folks who now I found a new acupuncturist, especially for infertility, those sorts of things. And then your hour, 45 minutes, whatever the time is, they can commit to a session, their time, that is their time. It is about them. I hold them to holding it as sacred because for some people, that's the only self care they get, depending upon the circumstances. And all of my clients know if at any point, whether it's a partner, a spouse, a husband, whatever it is, we are always willing to bring them in to make sure support is in place at home.
Great. Now, if someone is listening and they want to connect with you, where should they go to find you?
They could always go on my website, which is www.serenesolutionsccs.com. There they can contact me, they can request an appointment, I make sure I put everything on there. So what the rates are, the insurances we accept, the states that I'm in, because I'm in 5 different states, anything they need to know, resources, all of that is there.
Perfect. And before we go, if you can share 3 pieces of advice for our moms to walk away with today.
The first piece of advice would be to find your trusted person that you're okay with talking to no matter what. The second piece of advice would be giving yourself grace.
Okay.
None of us are perfect. The third piece of advice would be it's okay to say no.
Love it.
Boundaries.
Thank you. Thank you. Thank you. Thank you so much for gracing our show. It's really been nice learning about what you do and what you give for your clients. So thank you so much.
Thank you.
All right. Are you navigating pregnancy and postpartum alone? Are you feeling overwhelmed by the lack of support? You're not alone, and you don't have to do this alone. With EM Care, I offer personalized in home and telemedicine support designed to guide moms through the challenges of the postpartum period. Whether you need total on call services or periodic check ins in the home, I help women recognize warning signs and I support you as your advocate, and I am here for you the entire step of the way. I want to create a postpartum plan that's all about you, your health, and your recovery. Follow me on Instagram at Dr. Chowa for tips, resources, and to book me. DM me or email me if you have any other questions. I'm on all social media platforms under Dr. Chowa, DrChowa. Let's build a village of support. Let's give you the hope you need to get through this period of time. Take care. My name is Dr. Chowa, and it's been lovely talking with you all today. Take care.